Friends, today we are discussing about the ulna bone. Let's introduce the ulna bone. This is the ulna bone. You can see its upper end is somewhat damaged, but we are still studying from this. The ulna is the medial bone of the forearm and is homologous to fibula of the lower limb. In Ayurveda, it is classified as the Nalakasti, situated on the medial side of the forearm in the anatomical position. It consists of a proximal or upper end, shaft, and lower end. This is the general introduction of the bone. Let's discuss about the side determination. Let's talk about side determination of the ulna. To determine where a bone belongs to the left or right side, consider the following things. First of all, upper end. Upper end is a massive and hook-like. This upper end is massive and hook-like, with the concavity, trochlear notch facing forward or anteriorly. It is a C-shaped or semilunar type notch. It is called trochlear notch. Its lateral border is sharpest or introosseous border. The introosseous border is the sharpest and must be directed laterally toward the radius. Lower end. In the lower end, the styloid process projects downward. This styloid process is damaged due to some reasons, but the styloid process projects downward from the posterior medial aspect of the head of the ulna. Let's see in my hand. This is the position of the bone. Upper end is facing or trochlear notch is facing anteriorly forward. The sharpest border, the lateral border, is facing laterally, introosseous border. And the styloid process, see, this is the styloid process. This is the styloid process. It is posterior and medially. This is the side determination of the bone. Proximal end. The upper end shows two notches and two process. The olecranon process. This one is the olecranon process. This one is a coronoid process. This one is the coronoid process. This is trochlear notch, which is C-shaped or semilunar in shape. This is radial notch, so that there are two process and two notches. The olecranon process. Let's talk about the olecranon process. Olecranon process having 5 surfaces and the coronoid process having 4 surfaces. The olecranon process projects upward from the shaft. This process projects upward from the shaft. You can see it has superior surface. This is superior surface. This one is the anterior surface. This one is the lateral surface. This one is the medial surface, and this one is the posterior surface. The anterior surface is articular. Anterior surface of the olecranon process is articular. It forms the upper part of the trochlear notch. The posterior surface from a triangular subcutaneous area, which is separated from the skin by a bursa inferiorly. This is the triangular area. You can see this is a triangular area. This is the triangular area. It is continuous with the posterior border of the shaft of the ulna. This is the posterior border of the shaft of the ulna. Its upper part forms the point of the elbow. This point forms the elbow joint. The middle surface is continuous. This is the middle surface. The middle surface is continuous inferiorly with the medial surface of the shaft. This is the medial surface of the shaft. anterior border and posterior border. In between these borders, the surface is medial surface. The lateral surface of the oligranulin process. This is smooth and continues as a posterior surface of the shaft. Continues as a posterior surface of the shaft. The superior surface in the posterior part shows a roughened area for the insertion of triceps brachii. This one is the coronary process. In Greek, it is called cross break. It having four surfaces. This one is the superior surface. This one is the anterior surface. This one is the medial surface. This one is the lateral surface. In its anterior surface, there was ulnar tuberosity found. The lower part of the lateral surface of a coronary process forms a depressed area to accommodate the radial tuberosity. It is limited by a ridge called supinator crest. This is the supinator crest. This one is the supinator crest. Medial surface, you know that this is the medial surface of the coronary process. It continues with the medial surface of the shaft. The trochlear notch forms an articular surface that articulates with the trochlea and the humerus of the elbow joint. You note that the major part of the elbow joint is contributed by the ulna bone, not the radius, because radius is articulated in the radial notch of the ulna. This is the type of a pivot joint. This is a type of pivot joint. The radial notch articulates with the head of the radius to form the superior radioulnar joint. This is the type of a pivot joint. Let's talk about the shaft. Okay, we are now discussing about the shaft. This is the shaft. This portion is the shaft. The shaft has three borders and three surfaces. The introosseous border or the lateral border. It is the sharpest border. It arises from the supinator crest. And the lateral border or introosseous border in its inferior can be traced as lateral side of the head. The anterior border is the thick and rounded. You can see that this border is thick and rounded. It begins above on the medial side of the ulnar tuberosity. Sorry, I am not introduced about the ulnar tuberosity. The anterior surface of coronary process below it is triangular in shape. This is called ulnar tuberosity. The medial border starts from the medial side of the ulnar tuberosity. You can see medial side of the ulnar tuberosity and terminates at the medial side of the styloid process. स्टाइलोइड प्रोसेस के मीडियल साइड में ये टर्मिनेट हो जाता है जाके लास्ट में. Then the posterior border is subcutaneous. I will show you that this is the triangular area. At the apex of the triangular area, this area is subcutaneous. At the level of apex of the triangular area, the posterior border starts and terminates at the base of the styloid process. Base of the styloid process पे जाके terminate हो जाता है. The anterior surface of the shaft lies between the anterior and introosseous border, and nutrient foramina is seen in the upper part of this surface. It is directed upward. The nutrient artery is divided from the anterior introosseous artery. Okay, the medial surface lies between the anterior and the posterior border. Anterior border and posterior border. In between these, the medial surface is found. Let's talk about the posterior border. Lies between the posterior Introosseous border. It is subdivided into 3 by 2 lines. An oblique line divides into upper and lower part. The lower part is further divided by a vertical line into a medial and lateral part. This is the introosseous border. See, this is the introosseous border. This is the posterior border. In between two borders, the posterior surface is found. Lower end. The lower end made up of the head and the styloid process. In this bone, styloid process is damaged due to some reasons. The head articulates with the ulnar notch, the radius to form the inferior radioulnar joint. In wrist joint, major part of the wrist joint is formed by the lower end of the radius. Okay. The inferior radioulnar joint, this is also a type of pivot joint. In human body, there are only 3 sites where articular discs are found. First, TMJ joint, second, sternoclavicular joint, and third one is the inferior radioulnar joint. You have to remember these things. The styloid process projects downward from the posterior middle side of the lower end of the ulna. Posteriorly between the head and styloid process, there is a groove found for the tendon of the extensor carpi ulnaris. Now talk about the attachment of the bone. First we discuss about the insertion in the ulna. First, the triceps brachii. Triceps brachii is inserted in the superior surface of olecranon process, but in the superior surface posteriorly, roughened area, triceps brachii. The brachialis is inserted in the anterior surface of the coronoid process, including the tuberosity of the ulna. Then the anconeus. Anconeus is inserted into the lateral aspect of the olecranon process and the upper 1/4 of the posterior surface of the shaft. Posterior surface, this is the posterior surface, lateral border and posterior border. In between the surface found is the posterior surface. So anconeus is inserted in lateral surface of the olecranon process and posterior 1/4 surface. There are 3 muscles inserted in the ulna. Other are originated from the ulna. The supinator. The supinator arises from the supinator crest and from the triangular area in front of the crest. Okay. Then the ulnar head of flexor digitorum superficialis. Flexor digitorum superficialis arises from the tubercle at the upper end of the medial margin of the coronoid process. Medial margin of the coronoid process, flexor digitorum superficialis arises. Its second head is originated from the radius bone. So I called the ulnar head. Then the ulnar head of the poronator teres. The ulnar head of the poronator teres arises from the medial margin of the coronoid process. This is the coronoid process. Just below the flexor digitorum superficialis, the poronator teres arises. Let's talk about the flexor digitorum profundus. Profundus means deep. Arises from the upper 3/4 of the anterior. Upper 3/4 of the anterior and medial surface of the shaft. First point. The second point is the medial surface of coronoid and olecranon process. Medial surface of the coronoid and olecranon process. The posterior border of the shaft. This is the posterior border. The posterior border of the shaft through an aponeurosis, which also gives origin to the flexor carpi ulnaris and extensor carpi ulnaris. There are aponeurosis of three muscles. Okay. Let's talk about the flexor carpi ulnaris. The flexor carpi ulnaris ulnar head arises from the medial side of the polygonal process. This is the polygonal process. Okay, this is the polygonal process and posterior border. The extensor carpi ulnaris arises from the posterior border, so that the posterior border meets three aponeurosis at this site. Now talk about the pronator quadratus. Pronator quadratus take origin from the oblique ridge on the lower part of anterior surface. Let's talk about the posterior side or posterior border, posterior surface of the ulna. There are three muscles originated in the posterior surface from above to downward. The abductor pollicis longus, below extensor pollicis longus, and extensor indicis. The introosseous membrane is attached to the introosseous border. In this border, introosseous membrane is attached. The oblique cord. Oblique cord is attached to the ulnar tuberosity. There is a oblique ridge. It goes from this side to this side, medial to lateral side of the radius. It is a flat ligament of forearm. Okay. The capsular ligament of the elbow is attached to the margin of the trochlear notch. The annular ligament of the superior radioulnar joint is attached to the two margins of radial notch of the ulna, this one and this one. There is a ulnar collateral ligament of the wrist, because the wrist joint is here and styloid process is posterior medial. The ulnar collateral ligament of the wrist is attached to the styloid process. The articular disc of the inferior radioulnar joint is attached by its apex to a small rough area just lateral to the styloid process. Articular disc is found in only three places: TMJ, sternoclavicular joint, and inferior radioulnar joint. The shaft and the most of the upper end ossifies from a primary center, which appears during the 8th week of intrauterine life. The superior part of the oligrenal process, this superior part, ossifies from a secondary center, which appears during the 10th year and joins with the rest of the bone by the 16th year. Lower end ossifies from the secondary center, which appears during the 5th year and joins with the shaft by 18th year. Okay. This is the bone of forearm, the ulna. In next session, we are discussing about its clinical anatomy. Thank you for staying in this channel. Please support, like, share and subscribe my channel. Thank you.